but supposed to be not,
Uh,
but you will get it from the opening statement.
okay,
Anyway,
okay, fine, 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 fine. Sandeep, I did not open this thing. I am also on the laptop, so
Okay, let it be. I will try to share later.
uh, mhm.
You
No issue.
do the case.
Okay, so give me the opening statement.
to her in the candidate.
Yeah,
Yeah,
I will
okay.
start, huh? I will start, okay?
Just a minute. I will give the opening statement first. Okay. This is a 6-year-old Jay. Has the mother brought him to the OPD because he has a recurrent chest infection. Please examine him.
Okay, okay. So, hello, good morning. I'm
Hello.
Dr. I will introduce myself. I'm Dr. Hiren, one of the children doctor here. I will ask Jay, hello Jay, how are you doing? And I will clarify my role to the mother. Like I'm here to examine the Jay today. Is that okay with you? I will seek permission. I will observe the hand hygiene, and I'm talking to the Jai. Jai, what did you eat today in the breakfast? And I'm looking around. I'm looking for any medicines, any uh, equipments, or any oxygen or any device together with him.
There is no
Is there
device.
anything?
Yeah, there is no device, but there is a blue inhaler with the mom hands.
Okay, okay. And I'm looking for any dysmorphic feature. Is there any dysmorphic feature?
No dysmorphism.
Okay, I'm confirming on the first look. I'm confirming the general belt whether looks underweight, obese, or the normal build.
Okay, he's as you see, he's faulty growth. Okay, he has faulty growth.
Okay, okay. And I'm talking to the Jay. Is it talking with me?
He is interacting well with you, but you find that he is a bit distressed.
Okay. And also, I'm looking whether he looks sick look or well looking.
No, he isn't in ongoing disease right now. I told you he cannot just complete the talk with you. You feel that he's a bit distressed. No more.
Okay, okay. Uh, so now I would like to look in the hands. I'm looking for uh, any clubbing, any multiple cannulation marks, any tremor, any
Okay.
peripheral cyanosis.
Okay, there is clapping. Okay. No
Mhm.
cyanosis, no peripheral cyanosis. But how can you examine for tremor?
Tremor, I am just asking him to keep the both hands like stop the traffic light, and
Okay.
I'm looking for the tremor. I will ask the him to keep both the hands straight in front of his chest.
Yeah. Okay, no tremor.
Okay, okay. I'm looking for the pulse, and I would like to know the respiratory rate and set of the vitals.
Sorry, doctor, step by step. You want to examine the pulse? Okay.
Yes.
Okay, pulse 130.
Okay.
Okay.
And respiratory rate.
Sorry.
Respiratory rate.
Respiratory rate is 38.
Okay. And also, I would like to have the temperature and the saturation also
Okay,
at the end
saturation.
of my examination. Yes.
Saturation now is 90.
Okay. All right. I'm looking to the head, whether there is any hearing aid, any scar mark on the head, or any eye vision, any visual aids like eyeglasses?
No eyeglasses. Okay. And what do you mean by scar marks in the head?
Is there any scar or any shunt, or any operation done in the head?
Nothing in the head. Nothing in the head.
Oh, okay. I'm looking into the eyes for the jaundice and pallor.
Okay. Not there is pallor, but no jaundice.
Okay, and I'm looking to the uh, uh, mouth for the looking from the back of the tongue for the central cyanosis, as well as looking for any abnormality like cleft palate or any abnormal dental hygiene.
There is poor dental hygiene. Okay, but no central cyanosis.
Okay, and also at the end of examination, I would like to see the examine the ear, nose, and the throat also. I'm moving to the neck. I'm looking for any scar mark of the central line or any
Yeah.
enlargement of the lymph node.
There is a scar on the left side for central line.
Okay, is there any potaket or the previously healed scar of the previous old central line?
No cortical.
Okay, okay. I'm now. I would like to examine the chest. I'm requesting Mom Jai. Mom, can you help to take off his shirt?
Okay.
Okay, so I'm looking the chest, looking for the symmetry as well as any visible scar from the foot end and from the side end.
Okay. There is lateral thoracotomy scar on the left side.
Okay, and mm, I'm looking for. I'm now. Um, I'm going to feel the expansion of the chest, and I will tell if is there any sore.
Any sore? No.
Does he have any sore? Okay,
No. There is
so I'm
limited
looking.
of the chest bilateral.
Okay, so I'm quickly looking for the chest expansion as well as also I'm looking for the uh, apex, whether it's a dextrocardia or the levocardia, and the position of the apex,
The
apex
apex.
impulse
Yeah, apex speed filled on the right side.
in the right side.
It's
Okay,
intercostal on the right side.
okay. Also, I'm looking for now um, position of the trachea, whether there is any deviation or not. Central or
Centralized.
okay. And meanwhile, after that, I would like to, since the child is in slightly distress, I would like to quickly do the auscultation first. And I'm looking for the air entry, breath sound, the character of breath sound, and any adventitious breath sound in all the front 6 areas, as well as on the back.
By auscultation. You do auscultation. Okay. There is diminished entry bilateral on the basal lung tooth. Okay.
Okay,
And
diminished by bilateral air entry on both lung fields.
basal lung field. Basal
Okay,
lung. Okay. And
okay.
there is rails here on both sides.
V's or
Rails.
rails. Rails. Okay, okay. Also, I'm auscultating on the back side, and after that, I'm after doing that, I would like to check for the vocal resonance by asking him speak 99 on
Okay.
both the side, on the front and back.
Okay. The front and back.
Okay,
Okay.
okay.
There is there is diminish so exaggerated vocal phragmitis on the lower lung zone.
Exaggerated. Okay. Okay. And now I will see for any, I will go for the percussion. I will ask Jay, I'm going to tap on your chest. If it hurts, let me know. And I will do the percussion on the front, 6 areas, starting from the clavicle, looking for any dullness is there on the basal area or not.
There is dullness on the right basal.
Okay. And also, I would like to check the TVF, tactile vocal phragmitis.
Doctor, you asked
After,
it, right? And I
yeah,
told you.
vocal resonance, I asked. Okay. Now, I would like to do the same on the back. And after doing, I would like to examine the lever, any push down lever, and the placement of the lever, whether it's any situs inversus or not.
Pancreatic inverse.
There
Liver
is.
on the left, liver on the left side.
Okay. Also, I would like to see the any toenail clubbings or any pedal edema.
Time Dr. Aaron.
I think
Time
it's
done.
Yeah, it is 3 months up.
Yeah,
3 minutes.
because I feel that you talk a lot. More
Wow.
than 6 minutes.
6 minutes done.
From
Yes,
last
in
time.
between I told, but you were speaking, so you didn't heard. It is already you are this is now for 5 minutes up.
Oh, you have to stop, no? You have to
Why
stop.
you didn't stop him?
Who heard the? I did not hear
Your
when
mic
he
was mute,
spoke.
Dr. Jay.
No one.
Okay.
I was a timekeeper. I don't
You
know.
have to stop. You have to stop.
Hmm.
Anyway, so okay, let me summarize. So today I examined 6-year-old child Jai, who looks thin built and who looks in distress, who looks unwell. He's tachypneic and tachycardia is there. Saturation is 90, and he has a clubbing and no cyanosis. He has a pallor, as well as he's well communicating with me, and also he has bilateral diminished air entry, and he has a left lateral thoracotomy scar, and there is also a scar on the uh, right side for the previous central line, and he has a dextrocardia as well as the situs inversus. His liver is on the left side, and uh, he has a tachypnea as well as bilateral rails, and there is no pedal edema. So to complete my examination, I would like to plot him in a appropriate centile chart. Would like to check the forelimb saturation as well as the mm, also I would like to examine the abdomen in detail and the cardiovascular examination also. And putting these findings together, I would like to consider most likely on the top of my differential, most likely Cartagena syndrome. And also, I would like to keep the other differential. I would like to think of like probability of primary ciliary dyskinesia and um, immune deficiency as well.
Yeah. What else?
And mm, secondary infection with the Carpenter syndrome.
I mean,
And
it's exacerbation due to superaided infection.
yes,
Okay, what else you have to include in your differential?
uh, immunodeficiency, Carpenter syndrome, and primary ciliary dyskinesia. Cystic fibrosis
Yeah. Okay.
also could be, but there is, I mean, the features are more consistent with the Cartagner, as
Yeah.
there is a situs inversus and
Why you say here
dextrocardia.
it's Cartagner syndrome, not primary ciliary dyskinesia?
Cartagner syndrome is a primary ciliary dyskinesia is one of the component of Cartagner syndrome. So situs inversus together
Yeah.
with the primary ciliary dyskinesia and dextrocardia is the Cartagner syndrome. Without that, it's a primary ciliary dyskinesia.
Okay. Okay. Any other organ you want to examine? Any other system?
Yeah, because of situs inversus, I would like to do the detailed abdominal examination, and there is a bilateral rails are there. Also, I would like to see the second heart sound. I would like to listen the second heart sound and would like to rule out the component of secondary pulmonary hypertension if he's having a chronic lung disease.
Okay.
And I would like to
Yeah. Keep on,
check
please.
the forelimb saturations also.
Sorry, doctor.
And
Why forelimb saturation?
because he's having saturation 90 only and he's in distress.
Yeah. Do you expect that there would be a difference in the upper limb between upper and lower?
I don't know the long-standing history, but the recurrent chronic lung disease can cause pulmonary hypertension, and which might give some differentiation in the saturation.
Okay. Okay. And how do you would like to manage this patient?
I would like to take a full history set of the vitals, would like to involve my seniors and consultant. As the child is in the distress, would like to start the airway breathing support assessment, and after that would like to consider for the oxygen and oxygen support, as well as the um, in hospital admission and the management. Probably also need support of the IV fluids and IV antibiotic also, but I would discuss this with my consultant and then we'll go for it. And also I would like to do the set of the primary baseline investigation, which includes the X-ray chest, complete blood count, and
Just the X-ray is sensitive in this patient, or you need a high modality radiological.
first I would review the record, and first I would consider still the chest X-ray, and if there is because child is right now in the distress also, so it is better to do the bedside chest X-ray considering his distress and oxygen saturation.
Okay. Okay. And before you told me that you bought Cartagner syndrome on the list of your differential. So how can you just investigate for Cartagner syndrome, or you prove that it's a Cartagner syndrome?
It's a clinical diagnosis.
Mhm. There is no radiological, no lab investigation you'd like to do?
What I would like to consider is like for primary ciliary dyskinesia, you can do the nasal saccharine test. But Cartagner syndrome is a clinic, which it is a
Primary.
collaboration. Yeah, collaboration of the primary ciliary dyskinesia with the dextrocardia and situs inversus.
So how you examine for, how you investigate for primary ciliary dyskinesia?
Yeah, there is a test for nasal saccharine test, as well as there is a measurement of the um, this potential nasal ciliary potential, and also like nasal mucosa brush biopsy.
Okay. Okay. Thank you, doctor. Thank you.
Thank
Dr.
you.
Thank you, Dr. Heron. Well done. Okay, but I feel that you're a bit, so sorry to say that, a little bit disorganized. Okay, you just go for. You told I would like to expose. So the exposure at the start of before you examine the patient, before you are looking at the patient and you ask him to lie down, please ma'am, can you take off the shirt? Because when you look at the chest expansion and the diameter, you have to look while the patient is exposed. If you just would like to look at there's any scars in the chest, any discrepancy, you have to just expose the patient before you even touch him, before you look at him. Okay, then you go step by step from hand to head. Okay, but you forget in the head to just look at the nose if there is any polyps or not, any
But I
tissue.
mentioned, no, I mentioned the nose, like
Sorry, I did.
intentionally I kept like nose and throat, both I mentioned, ear, nose and throat. In fact, I mentioned 3 of them.
Okay. Okay, but please, in your examination, just keep on the respiratory. ENT examination, you have to mention it at the end. I'd like to complete my examination by ENT, but I mentioned the nose as while you are examining, just to look at the patients. Okay, I'm not talking about detailed ENT examination. Okay, I'm just while you are looking like the mouse. You told me I will look at the dorsum of the tongue if there is any dental caries, if there is any oral ulceration, like that. Okay? You have to just look. If there is any obvious polyp or discharge, okay, from the nose, you have to comment on it. Okay? You asked about the heads. Here in primary ciliary dyskinesia or Cartagner syndrome, as you mentioned, that Cartagner is primary ciliary dyskinesia with dextrocardia. But in primary
Right.
ciliary dyskinesia, they may be associated with ventricular hypertrophy, okay, hydrocephalus. So the head of the shape of the head will be increased in size, okay, or there is any shunt. So hydrocephalus may be associated with primary cellular dyskinesia.
Yeah, that is why I asked you for the shunt, no?
Yeah, yeah, okay. And you're going down. You asked about the scar in the head, okay? Just tell that I'm looking at the head shape. Is there is any increase in the head size, any obvious shape of the head, or any shunts? If there is no increase in the head size, you will searching for a shunt.
Yes, I mean, even if there is a shunt, the chances of hydrocephalus most probably resolve,
Yeah,
right?
I mean, if you just see the head size is normal, okay, and there is nothing obvious about the head size, nothing of significance, you will search for a shunt.
Uh, if it is normal, no. But if I feel the chronic immunodeficiency and just like in a picture you showed a child like kind of a malnourished and all, and this type of child we have to see actually. There can be many things like CP and chronic aspiration. So
Yeah, in my
I
opinion,
would
I don't
consider.
know. In my opinion, okay, and anyone correct me if I'm wrong. If I didn't see anything significant about the heads, any misalignment of the eye, nothing significant, I won't search for a shunt. Because shunt operation for any hydrocephalus, okay? If the patient isn't hydrocephalic or macrocephalic, why I have to search for a shunt? This is my opinion. I don't know.
Hmm.
Okay.
The thing is, like they are saying sometime, like as in this case, on the beginning, I did not expect this to be Cartagner or primary ciliary
Yeah.
dyskinesia. But generally, hearing aid and this shunt, I mean, this is online exam. If you ask what's wrong into that, you are not doing, if you have to do a live patient, then you will keep on searching and you may not find. Here,
Yeah.
if you ask, there is nothing wrong.
Okay. Okay. So no. I'm just asking you. I'm not. I'm just asking. I'm just. Yeah. Just this is my opinion. I'm just asking if it's okay. I have to ask. Okay. No worries.
There are many, I mean, the clauses in between, like let's say when you do, many of the time I mention front and back. Ideally, if you do the really, in reality, you have to do on the front first and then you have to go for the back. But
Yeah.
these kind of things are subjective. Okay.
Sure.
So,
Because that's I don't know. But why you didn't for your examination? Why you didn't finish the front first, then you go to the back?
that's what, no, there, that's what I'm telling you. If you do in the front, really, uh, you can do, but when the child, there can be a question like child is tachypnic tachycardic, saturation is 90 and you would like to do percussion. In real life, would you do percussion when the child is
No.
tachypnic and tachycardic?
In real life, I won't do it. Okay, because
So
auscultation enough. Auscultation for me enough, and I have to manage the patients. But in your
exactly.
examination, you have to complete the examination. So you have to look, okay, then feel, then percuss, and auscultate.
So
Look
I
for
choose the middle way. I choose the middle way. I said yes, opportunistic, be the auscultation first and do this thing. Like auscultation, when you do auscultation, you can do either at the same time, but you
yeah.
ask for permission and then you go for like percussion. I mean, if you didn't, if you, we don't forget the steps, it's should be okay if we don't forget the steps.
Okay, but
Per,
you know,
percussion we can always keep late, and examiner might not also want us to do that.
Yes,
yeah,
yes.
Because see, like if we start percussing, child may get irritated, and we may miss the important auscultatory findings.
Yeah, percussion should be
Like main
last.
respiratory is more of auscultation.
That's why I kept it
So
last.
like right, that was a good approach actually. Like we should say like I would like to take the opportunity to auscultate the first, and then I will do my percussion and palpation. That
Yeah.
would be a reasonable decent approach even with the small children. Like 6-year-old child, but after percussion he also have there is chance that he may get irritated. Even same with the
Right.
cardiovascular case. Do the auscultation first, then you do the percussion if you want to. Examiner don't, most of the cases the examiner don't want us to do the percussion. So I think auscultation would be first.
yeah, yeah. Okay. So take a permission to auscultate first, then
Yeah,
you
you just
just
mention
palpate
with the
and
examiner.
percuss.
Yeah, yeah. Even
Mm,
for the
mm,
shunt,
mm.
Hiren, I think we
Yeah,
can mention in
but
the end.
for the shunt,
Hello?
hello.
Even for the
Yeah,
shunt,
yeah.
Yes.
Keep on.
we can mention in the end after completing the
Mm,
respiratory examination. If the target, if our this opening statement is to examine the respiratory system, so we should focus more on the respiratory system first
mm,
rather than completing the examination. Hello, am I audible?
mm. Yeah, yeah,
Yes, yes, yes.
yeah, yeah.
Like we should first focus on the general
Okay.
examination plus
Mm,
respiratory examination. Then we would like to complete my examination by checking the head for the shunt. That would be also reasonable thing. Like your thought of Cartagena syndrome after doing the respiratory examination, not at the first. That will give you the impression that you are forming your diagnosis after doing the complete examination. That if you do that way also fine, but like doing that, those things should not consume our time from the main examination. Our main examination is the respiratory examination. Like ENT, head for shunt, these are good points actually, but we can just mention in the end also. That what I want to say.
Yeah.
What do you feel?
Yeah, in real practical, this is, I think, here it is asking, no, so you can ask, but in real life difficult. If you spend time searching shunt, it can
Our
consume time.
maximum time
Yes.
should go to the main task. That is my point.
Yeah, yeah.
Our main task is respiratory, more of systemic examination.
Okay.
Hmm?
Yeah,
So anything else? Otherwise, then we'll stop here.
Dr. Dr. Jay Prakash, Dr. Any other things to be added?
Yes, like Dr. Aaron, in your case and also in all we really we should be more like the focus system. So we should also be opportunistic in this, as Dr. Sandeep told, no? What the respiratory system, our main should be on the respiratory system.
Not hear you. Your sound is interrupted.
Hmm.
Like, see, 6 minutes is a very short time actually
Yes,
for
yes.
the online examination. If you do actually now, we can finish the examination in 6 minutes with doing everything. But online examination, describing the time is short really.
And Dr. Hiran, you reached after you started this respiratory system after the lapse of 8 months, 8 minutes.
It was
Mm-hmm.
After 8
You have
minutes.
to tell, no, you have to tell at 6 minutes, like stop.
But
At 6 minutes, you have to stop us. Wherever it is, you have to stop.
but
Uh,
yes, right.
so that we don't move
Should
ahead.
like examiner will tell us, Hiren, examiner will tell us directly at 6 minutes, right?